So we treated him for 5 minutes, just pushing up through the leg with the leg adducted about 10 degrees. And he appears to be much more symmetrical, not completely, not, there's a little asymmetry still there, it's just not as pronounced. Now if I try and induce posterior rotation, you can see there's excursion now. So I can take up the slack to an end point, and then I can spring it, and there is that spring, recoil. So we've restored that movement. Let's have you lie on your stomach. And now I'm going to test, he looks to be symmetrical on the iliac shelves. I'm pushing through that left iliac shelf, and I can take up the slack, and I can spring it. I'm going to do the same thing inferiorly. You can see that I can take up the slack. There's movement there and comes to a stop point. If I add additional force, that force translates through his lower leg, through his leg, and you can see the recoil. Okay, and going superiorly, you can see his whole body. You can see his whole body move when I push up to that stop point. And now I'm going to add additional force called the spring test, and you can see it spring and recoil. So we now have vertical translation as well. The ligament is not as pronounced, and when I twang it laterally, I feel a little bit of give, and I can indent it a little bit. So it feels, the tone feels the same as on the right side. Let's test your strength. So extend this hip, and ready? 1, 2, 3. So I can still bring it down. Okay, no real change there. Let's have you lie on your back. And bring this leg up. And hold it there. 1, 2, 3, go. So this is distinctly stronger. How do you feel?
Good.
Okay. Can you show us, we had you walk around a while ago and you tested it. Can you show us the movement that feels improved? Standing on one leg.
Yeah, standing on one leg. It's kind of feeling it a little bit now again.
So you're aware of the discomfort.
Yeah.
Okay.
But it did. I mean, a minute ago it did feel, just after one, it was feeling improved. So.
Okay.
I'm feeling it a little bit there, but that might also just be because when I extended, I felt it with that.
Sure.
Maybe it's just kind of lasting from that.
You bet.
So.
Well, we'll continue to work with the pattern. I'm going to continue to look, check the sacral mobility and check mobility at L5, and take it from there. We did improve mobility through the pelvis, and so you no longer fit that definition of a so-called downslip ilium.
Okay.
And the sacrotuberous ligament tone changed.
Okay.
And your strength in hip flexor improved. You're still painful in extension, but the hip flexor improved. So I think we're off to a good start for just being in the early part of the first visit.
Right.
And I thank you for letting us film. I appreciate it.
Sure thing.
Thanks.